behalf of the President of Gulf Medical University and Provost Gulf Medical University, and on behalf of the Department of Internal Medicine, Gulf Medical College Hospital and Research Center, I extend a warm welcome to all of you to this National Conference on Place in Internal Medicine. As we have stepped into the new year, at the GMU we dedicate ourselves to the mission that we have set, the mission to strengthen and to promote excellence in medical education, biomedical research and patient care. And today we are going to see a presentation ceremony where His Excellency Sheikh Hamdan bin Humaid Al-Naimi, the Chairman of Ajman and Planning Department, Healthcare of the Community in UAE, they will be honored by His Excellency. Start the academic scientific morning session. We have it will be chaired by me and Dr. Maher Khalid Jalul. And at the end of the first session, we will have a presentation ceremony by His Highness Sheikh Rashid bin Humaid Al-Naimi. Vidar Nabi, she is a consultant pulmonologist from Al-Zahra Hospital, Sharjah, and I invite her to give a presentation. Dr. Vidar.
What is the comorbidities and confounds that alter asthma phenotypes? This asthma actually, there is something that's changing. Why this happens? Why we have different types? There is a numerous immunity process. They have a role in allergy, existing pathopathologic biology. For example, you mentioned about smoking and all smoker exposure, like a passive smoking also, created asthma overlap with the COPD.
He's an international cardiologist from Ajman Hospital as well. Dr.
Right. say he proved that he's an excellent educator.
Ladies and gentlemen, it's with great pleasure I announce the arrival of our founder president board of governors at Medical University, Mr. Tulin Moideen, and our provost, Dr. Geeta Ashok amongst us. We have just got the news from the ruler's court Ajman that there is a demand in the Indian family, so they are in the state of mourning, so His Highness Sheikh Rashid just in the university today, and we will be, once we welcome them, we will begin the program now with the recitation from the Holy Quran, and our Department of Internal Medicine and the Management, the whole team has put in a lot of exercise in the last couple of months to identify some of the stalwarts in the field of internal medicine from all over the country for their achievements and contributions. And since we decided to honor them with a special honor and award of recognition, and then we will be also presenting mentors and honoring all the invited faculty and speakers who are with us to make this conference a success. May I have request students to please come and welcome our former president.
وبشر الذين آمنوا وعملوا الصالحات أن لهم جنات تجري من تحتها الأنهار كلما رزقوا منها من ثمرة رزق.
Long-awaited, our cherished dream of honoring some luminaries has come now. Though many of them are nationally and internationally recognized, but for the benefit of a very few, I need to complete the formality. The recognition right from the beginning of Professor England and Scotland and obtained fellowships of the London, Edinburgh and Glasgow Colleges of Physicians. In 1976, he known as the Violet Authority. During the early part of his tenure, he developed the medical services in cardiology and established several specialties in general, and has been the clinical dean of the college for the last. He restored with many honors by international bodies, a special recognition as Diabetes Ambassador for the UAE and a senior trainer from the World Diabetes Association co-host Professor Geeta Ashok. Please come on stage to do these honors.
Because I have been coming here ever since the medical school started, and I practically have been attending at least once a year over the period of time that the medical school has been in existence. I thoroughly enjoyed it this morning because, first of all, I think it is a lovely meeting. There is good presentations and the audience seemed to be interested. And secondly, on a personal basis, I have been very fortunate in being honored by you in giving me this very special award, and I will treasure it. I was particularly interested this morning when I arrived because I was shown a photograph of myself when I was a student in 1956, and it brought back memories of my student days. And I am sure that medical students today are just as enthusiastic as we were in our time. Perhaps they are not so good at keeping to time. But I heard something this morning from Professor Shakti, and he said, yes, they do keep to time, but particularly when it is time to leave rather than when it is time to come. I hope that those comments are an appreciation of how much I am enjoying today, and please do invite me again. I'd love to come.
It's my pleasure to be here and to be among the awardees of internal medicine in this symposium in general medicine arranged by the Gulf Medical College, which has been established for 14 years and have been graduated many excellent students who are working with us and practicing with us in the Emirates. In fact, this is considered a very nice and great gesture by the university to award people who have worked in field of medicine over many years and have participated to the development of health status in the Emirates.
This is my wife, Jane. And this young lady here was actually the second intern that I had in the Department of Medicine in Dubai. And she was also so-called product of a friend of mine, Professor Fennick in Kuwait, who was the founder professor of medicine. And she came to me highly recommended by him. And she hasn't been disappointing in any sense at all.
In fact, I am honored to be trained by two Maltese, Professor Fennick when I was at the university and after graduation, even before graduation, with Professor who is considered to me as a godfather. In fact, he teach me all the way and he supported me all the way till I reach this stage. I'm really honored to be with him. Thank you very much,
Probably this is coming from your medicine background, production, you that you have the authority, that you have the The second basic point is, if this is a possibility, and indeed it is a possibility, I'm particularly worried about the
try to implement them, and we learn from our mistakes, and we definitely will try to